Hi.
Hi, how are you?
Good. How are you? Thanks so much.
I'm
Um,
good. Can you hear me okay?
yes, I hear you great.
Okay, wonderful.
Yeah, so we'll get started and then people will join in as we talk. So, hi guys, welcome back. So, today we're going to be talking about skin rejuvenation, which is a topic that you guys have asked me so many questions about in my DM. So, joining us today is the amazing and well renowned cosmetic dermatologist, Dr. Ortiz. So, she's here to answer any question that you guys have. And thank you so much for sending this list. So, we'll try to go to as many of them as we can over the 30 minutes, okay? So, I'll
Okay,
let
great.
Dr. Ortiz give a few words about herself and then we'll get started.
Hi, everyone. I am a board certified dermatologist. I'm the director of laser and cosmetics at UC San Diego, and I'm excited to be here. Thank you so much for having me.
All right, perfect. So from the question that they sent me, I saw there was a lot of confusion as to the areas of cosmetic procedures we have available, especially the difference between injectables, the different injectables. So one of them was Botox and fillers. So if you could like just say briefly what they are before we go into the specifics.
Yeah, sure. So Botox or neuromodulators, there's other brands too, like Dysport, Xeomin, Jeuveau. Those are basically muscle relaxers. So they help with wrinkles that are created with movement. So like the forehead lines, crow's feet. You can also treat the neck muscles. So basically anything that's wrinkles that are created with movement. Fillers help to revolumize. So as we age, we lose volume, we lose bony structure, and so we kind of start to get that sunken appearance. And so fillers actually help to revolumize. So wrinkles that are created from volume loss, so like smile lines or cheeks or under the eyes, you can help to define the jawline. So basically, Botox relaxes muscles and fillers revolumize.
Perfect. And also now, especially with the new trend toward natural versus organic, a lot of the question that I get was regarding whether Botox itself is a natural product of natural origins. Can you comment on that, please?
Yeah, it's an interesting question because the term natural, like what does that really mean? And I think the question really is Botox safe, right? Because we want natural things because we want them to be safe. So Botox is actually very, very safe. It's been around since the 1990s. We have a lot of long-term safety data. There's really no long-term side effects. The only thing we know of is that it actually improves depression. So like the side effect is actually a good one. Yeah, and in children, it's used for like cerebral palsy and much higher doses. So we have a lot of data showing that it's safe. So I'm not sure how to answer the word natural. I mean, it's like I guess technically it's a toxin produced by a bacteria. So I guess it's natural. It comes from a bacteria. But I think the question really is asking, is it safe? And yes, it's very safe when it's truly Botox, not counterfeit product, and when it's injected by, an experienced injector.
Okay, perfect. Thank you. And now a lot of the question that I get is usually regarding like a lot of patients want to know when to start doing those cosmetic procedures because there really is no set guidelines. So a lot of the question they are asking is like one of the questions like how do I know if I need Botox?
Yeah, so I think that's a really personal choice. I think the earlier you start, then you can prevent wrinkles from forming. If you start too late in life, let's say if you start in your late 60s, 70s, then the wrinkles have already formed, they're etched in, and they're harder to reverse. So if you start sooner, you need smaller doses and you can prevent wrinkles from forming. So I would say the sooner the better if it's in your budget. I mean, on average, don't start too soon. So like late 20s is probably a good time or early 30s, something like that. But everyone ages differently. So it's such a personal choice.
No, I agree. That's true. That's usually like the answer that I try to give some of my patients. The follow-up questions that I get sometimes is some patients, they say that I'm scared to get Botox early, which was a question that someone sent in because they told me my eyebrows might drop earlier. Is that true?
Yeah, I haven't really seen that too much. So the thought behind that is so you're weakening the muscle, right? And so over time, your muscle gets smaller. So you think of like your other muscles when you go to the gym. If you don't exercise, those muscles get weak. So same with like, say, your forehead muscles. If those aren't able to contract, then over time they do get weak. And the thought is that, you know, that could potentially drop your brow. Honestly, I just don't see that. So I actually think there's more benefit to starting sooner, like prevention, like we talked about, rather than, you know, the long-term consequences of dropping your brow. I think in those patients, they probably would have dropped their brow anyway. It's more of like genetic rather than like from the Botox.
Perfect. And a lot of questions, people are scared to start because of the pain. They think like it's painful to do Botox.
Oh.
Think about that.
I mean, you know, it is a needle, it is an injection, but we usually use really small needles. You know, there's about a dozen injections or so, depending on like how many areas you're treating. But it's so quick and the pain is so minimal. I wouldn't let that prevent you from getting the treatment. Most patients who are scared of the pain and then finally do it, like at the end they're like, that's it, I would have done it so much sooner, you know. And I'm such a big baby, and like, you know, I do it, it's really nothing. The pain is just, I mean, it shouldn't be an issue.
All right, awesome. And so right now, as we know, there are a few different brands of neuromodulators available right now. Some patients want to know which one is the best Botox brand to get, quote unquote.
Well, I mean, Botox has been around the longest, so it has the most safety data. There's the most science behind it. You know, there's other brands that are good as well. So Dysport, I guess, can diffuse a little bit further. So if you're treating, say, the forehead, you might get better coverage. Xeomin doesn't have that accessory protein, so theoretically, like, there's less risk of forming antibodies to it. So if you feel like, you know, Botox didn't work or something, then you could try Xeomin. And then Jeuveau is like the newest one. I think they all work. You know, they all work. It's like Coke and Pepsi. Some people like Coke, some people like Pepsi, but Botox has definitely been around the longest.
Okay, perfect. So another question that someone sent in is regarding whether, as they get Botox throughout their lifetime, let's say does the dosage that they need over time increasing with their age?
It's actually the other way around. So, yeah, so as you do Botox regularly, your muscle weakens. And so you actually need fewer units rather than more units if you do it consistently.
Okay.
If you start when you're older, then yeah, you're going to need more units. But if you consistently do it, then your muscle weakens, and usually you need fewer units.
Okay, so speaking on consistency, how often, let's say someone were to start, how often would they need to redo to keep up the maintenance of their Botox?
So on average, Botox and the other brands last about 3 to 4 months. So again, it's a personal choice. I have some patients who come in and they're like every 3 months on the dot because they don't want to lose that look. I have other patients who are more busy, and so they can only get in like twice a year. And then other patients who come in just for special occasions. So if you want to maintain the look, you have to come every 3 to 4 months. There are, however, newer neuromodulators that are coming out, which will last a little bit longer. There's one from Revance, doxybotulinum toxin. It's not on the market yet, but it seems to last more like 6 months.
Okay, that's perfect. So you guys gonna have a lot of options
yeah.
to go through. So regarding breastfeeding, somebody wanted to know, because they know they can get it during pregnancy, but is it safe to get while they are breastfeeding?
You know, I actually waited. We don't have a lot of safety data on that because it's a hard study to do. I mean, the amount of Botox or neuromodulator that gets into breast milk is probably very minimal, but just given like the risk, I would wait. Fillers are okay. I would just pump and dump with that because really those are so localized, and then it's just the lidocaine that you worry about. So fillers I think are okay during breastfeeding, but I just have my patients wait for Botox just because it's not worth the potential risk. If something happens, you don't want to wonder if you did something, you know, so I just say wait.
Perfect. No, I completely agree. And there was just speaking on possible complication, like we can end the Botox session. What are the side effects that patients should look out for, should like worry about? Because a lot of them, they were asking what side effects should I expect?
Okay, so for Botox, I mean, minimal pain from the injection,
Mm-hmm.
potential bruising. Usually it's just like a small pinpoint bruise, which can last about a week. And then you get like little blebs or little swelling dots for like 20 minutes, and those go away. And don't press on them because that will make the Botox diffuse. But those are the most common ones. The first time you get Botox, sometimes you can develop what feels like a headache. Usually it's just your first time and it just kind of feels heavy or like a headache. And so you can take Tylenol. In terms of like more severe side effects, drooping is the one we want to avoid. That's usually like technique dependent. So that's why it's important to go to someone who's familiar with anatomy, someone who's well trained, not someone who just took like a weekend course. And you know, if that happens to you, not to worry because it is not permanent. Just like Botox only lasts 3 to 4 months for wrinkles, any side effects will only last you a few months. So that's why there's no long-term side effects from it. But yeah, drooping is the one we worry about.
Perfect. So you touched on a question that few viewers have asked is regarding like the injectors. They say, who should I choose to do my Botox, fillers, or lasers? That's what the questions.
Yeah, it's so confusing these days, especially with social media, because some people are just really good at marketing themselves, but then don't even really have that much like training or education. So don't confuse like the number of followers with like how trained they are. So I think it's important to go to like a board certified dermatologist or someone who just does this every day, not someone who just does this like once in a while, because well, someone who does this frequently, and then also someone who's very well trained in like anatomy and how to manage complications if they occur or how to avoid them. So, you know, it's a hard question because you know there's a lot of information out there, but I would look for, maybe I'm biased, I would look for like a board certified dermatologist, and if they themselves don't do it, they could maybe recommend someone who does.
No, I can no. This is a great advice. No, that's true. So now we can go into the filler section because like we've answered all the questions that they asked regarding the Botox, and the one is regarding fillers because a lot of patients are worrying of whether or not they are permanent. So they say that how do I can I remove the filler if I hate it after it's administered?
Yeah, so there are different types of fillers. So most fillers are hyaluronic acid fillers. Those can be reversed with an enzyme called hyaluronidase. And then, you know, that can be reversed overnight, or it may take a few treatment sessions depending on the type of hyaluronic acid. Then there's polylactic acid, which is like Sculptra. That is a little bit more difficult to reverse. There are ways to dissolve lumps if you get them, but it's just a little bit more difficult. Same with hydroxy L-apatite, like Radiesse. That's a little bit harder to dissolve. Then there's permanent fillers. So things like silicone, which I had a case the other day. I actually had to like excise out the part of her lip that had
Or you had
developed a lump. Yeah, so silicone, I would not recommend. I know the newer brands of silicone supposedly are safer. I just personally don't like permanent fillers because if you have a reaction, then there's no other way to fix it except to cut it out. And then there's Artifil, which is polymethyl methacrylate, which is basically like little beads of plexiglass. Again, those anything that's permanent, I mean, it sounds good because it lasts forever. You don't have to do it, but anything that lasts forever, like your body treats it like a foreign object, and so it can form lumps or just, you know, there's more risk of reactions. So I would stick to, you know, HAs if you're worried. I like some of the other ones too. I just don't like permanent fillers.
Okay, perfect. And also now with the advent of Instagram, a lot of people they see fillers like the extreme end of fillers. So people who are naturally interested in like skin rejuvenation, not the one of the viewers said plastic look. She said, I'm scared to get fillers because I'm scared of the plastic look. How do I prevent that?
Yeah. So I would go to an injector whose look you like. So if someone looks fake to you, then they're going to make you look fake. So
Okay.
I would go to someone who you feel like looks natural to you, because, you know, your injector is a reflection of what you're going to look like. It's their like, you know, their aesthetic eye. So I think that's the most important thing. Don't go to someone who looks fake because then they're going to make you look fake.
No, that's really good. That's a good, really good way of saying it, actually. Because, like you said, beauty is in the eye of the beholder.
Mm-hmm.
Um, So the other question is just that. So one person was concerned about after they get fillers, what happened to the when the fillers were off? What happened to that space? They say once injected, does it affect the elasticity such that continuous usage is recommended so they don't get like they feel like they're getting a space because we're filling up a void? Can you comment on that?
Yeah, actually, there's studies that have shown that that space created by the filler actually stimulates your own collagen to remodel. So you actually make more collagen and your own skin gets plumper. So nothing that we do really is like going to make things worse as we age. Everything we do makes things better. So by, by using filler, you're actually stimulating your own collagen. And there's studies that have shown that.
That's awesome. And so this are for the men watching. So one of the male viewers they asked, are fillers just for women?
No, I mean, fillers are for anyone that, doesn't like the look of their volume loss. I think men are injected a little bit differently. So for men, you don't want to feminize the face unless that's a look that they're going for. So first of all, you have to kind of see what look they're going for. But for example, on the cheek, I tend to inject a little bit lower on men because you don't want that kind of like round apple cheek that women like. So yeah, so definitely men can get filler, Botox, laser, any kind of cosmetic procedure. And I'm seeing men come in more frequently these days. But they're just, the technique is a little bit different to keep them looking masculine.
Perfect. And commenting on techniques, this question was from one of our residents. They said, what technique do you use for lip injection?
Yeah, I use it. So, I mean, every patient is different, right? So I don't have one technique that I use for everybody. I have various techniques that I use for like what the patient is trying to achieve. So for example, for older women who have a less defined vermilion, then I kind of like to inject along the vermilion and redefine it, especially if they have like perioral rhytids or like smoker's lines. For younger females or males who just want like more volume, then I tend to inject more like the belly of the lip. And then for someone who wants more of like an aversion, not duck lip, but just more like lift, then I like to do like linear threads, like tiny little threads going in this direction to help like lift. So I have different techniques depending on like what they're looking for. But I think the key is to use small depots, like small injections, so that you're not getting like a lot of, lumpy bumps of filler. So, and then also there's less swelling when you do like small little amounts.
Oh, that's awesome. And just now that you mentioned the lumpiness, one person wanted to know what can you do to prevent the lumpiness from the fillers?
Yeah, so again, go to an injector that you trust because that's going to be very injector like technique dependent. And so like the first week or two that you get filler, it's normal to feel the filler. When you wash your face or when you touch your face, you're going to feel that the product is there because there is something there. And it takes time to assimilate into your skin, to assimilate into the tissue. So it's normal to feel the filler, but you don't want to like see lumps or bumps because that means that it was injected too superficially or too large of a depot. So I would go to someone that you trust, someone with good technique. And then if you do have a bump, usually that can be massaged, but it has to be pretty firm. So I'd recommend going back to your injector if it's been like 2 weeks and it's still there, and they can usually massage it. And if that doesn't correct it, then it can be dissolved.
Okay,
If it's an HA.
okay. All right, awesome. So now just like people had questions regarding application of filler to different part of like the face and even like in the body. So one of the persons she was concerned about whether nose injections, fillers are safe for nose injections.
Yeah, so non-surgical rhinoplasty or liquid nose jobs, they're so trendy right now. And it's something that I personally don't offer because there is a very high risk of blindness in that area. So blindness is a known complication of filler. It can occur from injecting any area of the face. It's been reported in many areas of the face. It's very rare. So it's like saying, if you walk outside, you get get struck by lightning. It's very rare, but it is possible. But the most common area where blindness occurs is right here on the nasal root. And so it's right where you're injecting for the, you know, non-surgical nose jobs. So it's not a hard thing to do. You know, I have patients who come in and they ask for it, and I tell them it's not that I don't know how to do it. It's just that these are elective procedures. I don't want to put my patient at risk for a complication that's like, you know, that severe, like blindness. So once I explain that to them, they're like, never mind, I don't want it. You know? So I just personally choose not to do that technique.
No, I completely, yeah, exactly. Because safety is like important, especially if you're getting something elective. So the next question is regarding eye bags and smile lines. I feel it's safe for that.
Yeah, so it seems like, you know, the complication we just talked about would be more risky under the eyes, but actually, like I said, most of the cases have been reported in the nose. So I do treat tear troughs, and I do use a cannula. So a cannula is like a blunted needle. So one, there's less risk of bruising and swelling, and then also less risk of getting it into a vessel. So I love filler in the tear troughs. I think it just gives you like a more refreshed look. It's just important not to overfill in that area, because if it looks puffy, it's just kind of a weird look. It is an area that's very sensitive, so patients need to know that like there could potentially be a week or two of swelling and bruising that may be more significant than when you inject other areas. So I just have them plan it out a little more. Filler in the smile lines is like a home run, you know, very minimal bruising or swelling, and yeah, pretty easy. You can also put in the cheeks to help lift, to help soften this too. I like to do both. I like to put the filler in the cheeks if they need it, and then also soften in the nasolabial fold.
Oh, perfect. That's awesome. So regarding, so again, I think that viewer was a little confused regarding Botox and fillers. Let's say like not really aware of the different way we can use it. So they wanted to know, because they have wrinkles, so they wanted to know, can you use fillers to remove wrinkles instead of Botox, because they were scared of that the Botox wasn't natural?
Well, you know, it's just in different areas. So it's like, okay, let's take your forehead, for example. You can put filler in your forehead to revolumize it, but it's not going to stop the movement of your frontalis. So if you're, you know, moving your muscle and creating those wrinkles from the contraction of the muscle, there's nothing that's going to stop or relax the muscle besides Botox. So filler is not a replacement for Botox. They kind of, you know, augment each other. So unfortunately, there's not a replacement for Botox.
This is good. Okay, so now we'll move on to the lasers, and there are a few questions. Mostly was the safety and skin of color. Those were the questions that I got. A lot of the people, they wanted to know, are they safe to use in skin of colors lasers?
You can definitely use lasers in skin of color. You just have to be aware of like the skin interaction. So you have to know what laser is safe, and you have to know how to change the settings. So with skin of color, it's really important to go to someone that is well trained. Like for example, if you want hair removal, you have to use a 1064 nanometer Nd:YAG, which is safe for all skin types. You know, it depends what you're treating, but there's definitely lasers that are safe for darker skin color. You just have to know which ones to use.
Perfect. And regarding laser hair removal, they ask how many sessions does it usually takes before they can see an improvement?
Yeah, so on average, it's 6 treatments, but everyone is different. I usually recommend them every 4 to 6 weeks so that you're hitting the different hair follicles as they cycle. So 6 treatments every 4 to 6 weeks. Some patients require fewer, some patients require more, especially in darker skin, because you have to be a little bit more conservative. It may take a few more, but on average 6.
Perfect. All right, so these were all the questions, and thank you so much for coming on this beautiful Sunday and answer all of our questions. So if nobody has any more questions, we'll end the session right now. And again, like, thank you so much, Dr. Ortiz, to come here and answer all our questions.
Awesome. Thank you so much. Have a good Sunday, everyone.
All right, bye-bye. Thank you.
Bye-bye.
Bye.